Hi, everyone. This is Dr. Kaffer, and I am the physician at Star Wellness MD, which is a clinic in Universal City where we specialize in all things weight loss, aesthetics, and wellness. So, I wanted to make this extremely amateur video, essentially answering some of the questions that I get in clinic. So let us get into it. So today I'm going to answer questions on semaglutide versus tirzepatide. What is it? What's the hype? Essentially, semaglutide pretty much mimics the hormone called GLP-1. So what GLP-1 is, it's an insulin-like peptide, and what it does is slows down food as it goes from our mouth to our stomach. Essentially, makes the stomach emptying longer. So what it does is, once it slows that passage of food, then we feel fuller, longer, and tells the brain that, hey, we're still full, and essentially also helps control blood sugar. So tirzepatide, on the other hand, does every single thing that semaglutide does. However, instead of just acting on one hormone, the GLP-1, it acts on two hormones. So it acts on GLP-1 and it acts on GIP. So GIP essentially stands for glucose-dependent insulinotropic polypeptide. And I'm not going to repeat that. Essentially, we'll call it GIP from now on. So what GIP does, it enhances everything GLP-1 does, but also helps us feel fuller longer, makes us feel less hungry, and burn more fat. So in one way, you can say that tirzepatide is superior to semaglutide because it acts on two hormones instead of one. Now, some of the things that we have to look at is, okay, fine, tirzepatide is superior to semaglutide in that regard, but how much weight do you lose with each one? So some of the studies that were done showed that with semaglutide, you can lose 15 to 20% of your body weight, while with tirzepatide, you can lose 20 to 25%. So if you weigh 200 pounds, with semaglutide, you can lose 30 to 40 pounds, and tirzepatide, you can lose 40 to 50 pounds. So tirzepatide is superior in terms of the amount of weight that you lose. Now let's talk about cost. We all know that if things are not affordable, it's always harder to sustain that thing. In this case, semaglutide is much cheaper than tirzepatide. At our clinic, we start that starting dose, which is 0.25 milligrams, starts at $120 a month for the medication, compounded, while our tirzepatide starts at $230 a month for the 2.5 milligrams, which is that starting dose. And so obviously, tirzepatide is more superior and costs more. Now, accessibility. So there is a thing where now tirzepatide has been taken off the FDA shortage list. So we're looking at maybe February or March, we may not be able to compound tirzepatide anymore. So that would also impact what you decide to use because tirzepatide might be more scarce. And till insurance starts to cover the medication fully, then that could also be a problem. Now, side effects. I think the side effect profile is very similar because ultimately everybody's different. So most people have the nausea, the constipation, just feeling really full too fast and other things. And obviously some people have no side effects on semaglutide and have it on tirzepatide and vice versa. So it all depends on, who you are, how your body pretty much responds to medications. So the other point I wanted to raise, what do I tell my patients? So first of all, I have to look at all these factors, but ultimately, I tend to start most of my patients on semaglutide because it's more affordable to start with anyway. And we have tons of patients that lose tons of weight on semaglutide alone. But if we have a patient that is not losing weight on semaglutide, not responding to it like we want to, maybe the side effects are just too much, then we switch them to tirzepatide. If I have a patient that needs better glucose control, I would probably tend to start tirzepatide first. So, but at the end of the day, just talk to your healthcare professional, talk to your doctors, talk to your obesity doctors, and they will help make the right decision for you. I hope this answers most of your questions, and feel free to just drop some comments, PM me, and we'll talk about other topics later. Have a great day, and God bless.